So today we're gonna start a very important structure, which is basically the mandible. So let's start it. Bismillahirrahmanirrahim. So basically, you should know that mandible is a very largest and strongest bone of the human skull, which is located inferior to the maxilla and has a horseshoe-shaped body. It forms a very important joint, which is a TMJ joint. Okay, the body it acha. So basically, the mandible the mandible have the body. So the interior portion of the which is the interior portion of the mandible, it has two surfaces, which is outer and inner surfaces, two borders, which is upper and lower border. Okay, so number one, you can see here this symphysis, which is basically known as mandibular symphysis or symphysis menti. Okay, which is very important, you should know it. Okay, then basically you have mental protuberance. So mental protuberance is present here. This is the mental protuberance. So basically it is the inferior portion of the ridge that divides or encloses the midline depression. It is also known as chin. The chin, where is your chin? That is your mental protuberance. Okay, then basically the edges of the mental protuberance are elevated and forming mental tubercle. So mental tubercle is here. Okay, then laterally and below the incisive teeth there is a depression, which is known as the incisive fossa. You cannot see here, but incisive fossa is actually present below the incisive teeth. Then you have a mental foramen. The mental foramen is actually present. Okay, so the mental foramen is here and it is present below the second molar. Always remember where the mental nerve also exit. Then you have the oblique line. This oblique line is actually, you can see here, the oblique line is actually here. Okay, 1 minute. This is this oblique line, which is the courses posteriorly from the mental tubercle to the interior border of the ramus. Okay, so you should know it. Now we'll talk about the inner structure, inner surface structures. Okay, now you have mylohyoid line. This mylohyoid line is present here. This is mylohyoid line. Mylohyoid line. So basically it is a prominent ridge that runs obliquely downward and forward below the third molar. Always remember that it is below the third molar to median and below the genial tubercles. This mylohyoid line, below the mylohyoid line, there is a hollow out form. So it is submandibular fossa where submandibular gland is present. You can see here this fossa, submandibular fossa is present here. This is where submandibular gland is present. Then above the mylohyoid, there is actually sublingual. You can see sublingual fossa, which is above the mylohyoid line. So where sublingual is present. Then the posterior surface of symphysis menti is marked with the four elevation, which is known as the superior and inferior genial tubercles. You can see here this tubercles. Okay, so basically these are some small elevations which known as genial superior and inferior genial tubercles. Okay, then basically here are also some muscle attachments which you, if you want to know it. So okay, so some basically you know that there are condyle process, then there is coronoid actually coronoid process, then there is an fossa, which is retromolar fossa is also present here. Then antral alveolar septa, this is enter alveolar septa is also present. Then you have, okay, so you have lingula also here. Okay, lingula is very important for the lingual nerve. Okay, lingula is very very important. Then you have mandibular foramen also. Mandibular foramen is also present. Then you have this groove which is mylohyoid groove. Mylohyoid groove is also present. Then you have the pterygoid fuvea. This is the pterygoid fuvea, and you have actually the mandibular notch. This is the mandibular notch. Okay. Okay, this is the neck region. Okay, base, angle, body, and radius. So there are some muscle attachment. You should also know that which muscles are attached at which point of the mandible. Okay. So number one, vaccinator. Attacha. So vaccinator is that it originates from the oblique line. Okay. So vaccinator is basically originate from the oblique line. You should know some. Okay. Then you have depressor labii inferior and depressor anguli oris, which originates also from oblique line but below the mental foramen. Okay, so it is below the mental foramen. Then mentalis that it originates from the incisive fossa. Then orbicularis oris, which originate from the incisive fossa also. Then temporalis, which is inserted on coronoid process. Mesester is basically the insert on the outer surface of ramus and angle of mandibular. Medial pterygoid basically insert into the angle of the mandible here. Lateral pterygoid, which is actually inserted into the condyloid process here. Platysma is basically insert on the lower border of the here. Platysma is inserted or here. Anterior belly of digastric originate from the digastric fossa of gyneglossus that originate from the upper tubercle gynohyoid. Then it originates from the lower tubercles, which is here, these tubercles which are present. Okay, mylohyoid that originate from the mylohyoid line, which we have which is present here, this mylohyoid line. So basically a superior pharyngeal constrictor originates partially from the pterygomandibular raphe, which originate from the mylohyoid line. Okay, basically